Hello, everyone. Thank you for your time. My name is Vasilius, and as you know, depression is a common and debilitating mental health condition that affects millions of people worldwide. And today I'm going to talk about exploring modern, natural, and emerging approaches to depression treatment. I hope you find this presentation informative and helpful. So, our learning objectives today in this presentation are one, to better comprehend the nature of depression, its impact on individuals and society, and the diverse treatment options available. And two, to investigate the emerging role of psilocybin, ketamine, and cannabis in the treatment of depression. Before we get into treatments for depression, I want to take a quick review of what it is and how it's impacting individuals and society. So, we know it can be characterized as feelings of sadness, loss of interest, and decreased energy. But in research, I found that university students may actually be at a higher risk for depression because of all the things that come with going to university. And obviously, the impacts of depression can be far reaching, leading to significant functional impairment in everyday activities, social isolation, and increased risk of suicide. And the table to the left shows some diagnostic criteria for major depression. When it comes to treating depression, modern medicine offers a lot of effective approaches, and we've already explored pharmacotherapy, psychotherapy, and ECT in class. And through my research, I found that epigenetic based therapies hold a lot of promise for the future of depression treatment. One therapy, specifically histone deacetylase or HDAC inhibitors, aim to reverse epigenetic changes associated with depression and restore normal gene expression. And the image to the right explains how HDAC works. So usually they remove acetyl groups from histones, and the HDACIs or the inhibitors block activity of removal of acetyl, which allows loosening of the chromatin and increasing gene expression. In addition to traditional medical treatments, there are also several natural approaches that can be helpful in managing depression. So, lifestyle modifications like regular exercise, a healthy diet, and adequate sleep can improve mood and reduce depressive symptoms. Mindfulness-based therapies like meditation can help regulate emotions and also reduce stress. And while not a cure for depression, certain nutritional supplements may have beneficial effects on mood and symptom management. Omega-3 fatty acids have shown promise in reducing depressive symptoms, and vitamin D obtained from sun exposure or supplements may also play a role in mood regulation. In recent years, researchers have been exploring alternative and emerging therapies for depression. Some of the most promising and popular right now are psilocybin, ketamine, and cannabidiol, or CBD, from cannabis. And in the image to the left, you can see the shapes of these different chemicals. Psilocybin has received a lot of attention over the recent years for a few reasons, but we'll focus on its medicinal purposes with depression. And what psilocybin is, it's a naturally occurring psychedelic compound found in certain mushrooms that can alter perception, mood, and thought processes. And the mechanism by which psilocybin exerts its antidepressant effects is still being investigated, but research suggests that it is involving enhancing neuroplasticity, particularly in the prefrontal cortex and the hippocampus. And research on psilocybin's potential for treating depression has shown promising results, suggesting that psilocybin can induce rapid and sustained antidepressant effects. And in the graph to the left, patients took 2 doses of psilocybin 1 week apart. The first dose was 10 milligrams, and the second dose was 25 milligrams. And as you can see, nearly all the participants' depression was lower than when started, even after 3 months. Ketamine, an anesthetic commonly used in medical procedures, has emerged as a promising alternative therapy for treating depression. And what it is, it's a non competitive NMDA receptor antagonist and has demonstrated remarkable rapid acting antidepressant effects, providing relief from symptoms within hours or even days compared to weeks and months with traditional antidepressants. And while the exact mechanism of action is still being looked into, it is believed that ketamine's antidepressant effects stem from the modulation of glutamate receptors in the brain. And you can see an example of this in the image to the left. Cannabis is commonly used medicinally and recreationally. Here in the United States, you may even use it yourself. What makes this plant special is that it contains a variety of cannabinoids, including cannabidiol or CBD, a non-psychoactive compound that has gained a lot of attention for its potential therapeutic properties. CBD has shown promise in modulating synaptic plasticity, which is essential for learning, memory, and mood regulation. And the image to the left shows more detail on the mechanism of action. But it's important to emphasize that cannabis is not a cure-all for depression. and its use should be considered in conjunction with other treatment approaches, such as psychotherapy and lifestyle modifications. In conclusion, depression is a complex disorder that requires a personalized approach to treatment. Various treatment options, including modern medicine, natural approaches, alternatives, and emerging therapies, are available to manage depression. Further research is needed to fully understand these emerging therapies and optimize treatment outcomes for individuals struggling with depression. Thank you for your attention.